Hi everybody, it's Dale Creamer here. So we're very lucky to be in Bonn, Germany, and I'm extremely happy to have been trained by Professor Kovács, who's sitting next door to me. So, Prof, if you can just introduce yourself first, and I think basically tell us a little bit about what you've been doing here in Germany.
Thank you very much. It was a pleasure to have you here. Attila Kovács is my name. I'm interventional radiologist and neuroradiologist and the head of a specialized hospital focusing on interventional radiology and neuroradiology. At the beginning of my career, I was cardiac surgeon, but after a couple of years, I realized that there's a huge potential in minimally invasive medicine and image-guided medicine. Therefore, I shifted to interventional radiology and neuroradiology. We are internationally renowned experts in interventional oncology. We have the whole armamentarium of interventional treatments, not only endovascular but also percutaneous treatments, from radiofrequency to electroporation, electrochemotherapy, cryo, everything. And the same is true for the endovascular treatments. And we are collaborating and cooperating in a very integrative manner with oncologists, radiation therapists, and surgeons.
I must admit, this hospital and your establishment is very impressive, and it's been quite inspiring for us coming from South Africa to see what you've been able to achieve. But I think what I really would like to discuss about, and I think we'll focus in one particular area, is in prostate artery embolization. And what would you like to tell patients with regards to this procedure and its benefits that maybe our patients in South Africa don't know much about?
Yeah, thank you very much for this question. It's very important because it's a common thought that prostatic artery embolization could be experimental. No, it is not. It's the technique of prostatic artery embolization is already older than 45 years, and it was established for bleeding cancers, for bleeding treatments after transurethral resection. Definitely, 12 years ago, Francisco Carnevale and John Merritt published on that PAE, prostatic artery embolization, is very effective in the treatment, in the elective treatment of benign prostatic syndromes. What we know today, after tons of evidence we have on the efficacy, safety of prostatic artery embolization, that we are very effective in selected patients with more irritative storage symptoms and not so much voiding symptoms. We have to distinguish when we are assessing the patient. The big advantage of the prostatic artery embolization is that you have absolutely no drawbacks of classic transurethral urologic therapies like retrograde ejaculation, incontinence, and so on. But in selected patients, as I told, with predominantly irritative storage symptoms, we have tremendously good results in terms of reducing urgency, nocturia, and the sense of post-void residual. And these are the most important symptoms the patients are bothered by during daytime and also nighttime.
So we've had the great opportunity to watch you work and to be involved in the catheter lab and to see how you perform these procedures. So firstly, you guys have gotten it down to being efficient. You guys have your outcomes are great, and your patients have a great trust in you. And I feel like that's been something that I want to try and help our South African patients to understand, that through a very small keyhole incision into a blood vessel, and using very small catheters and very small particles with people with the adequate training, you can have great results without having to go for these quite invasive operations, which have already established complications like Prof spoke about, which is retrograde ejaculation being one of them, you know. And that basically means that after you have these procedures, you will never be able to conceive a child. So I think those are things that are quite important for our patients to understand.
Yes.
So these are things that maybe we're not talking about enough, but I think one of the greatest benefits of prostatic artery embolization is that we can achieve these benefits and have patients who are suffering with these symptoms, these irritative symptoms, as you say, Prof, and to actually be able to live better lives and have better quality of life. So, you know, I just wanted to say thank you for the teaching that you've given us, you know, and you know, how did you get the patients to, or your patients in Germany, to start seeing prostate artery embolization as a better alternative for them?
Great question. Honestly, it's the awareness that the prostatic artery embolization is a very effective therapy changed over time. At the beginning, we were thought to be the bad cops for the urologists, and in the meantime, it changed a lot. And urologists realized that we bring a huge benefit in the treatment of the patients, and we are widening the complete spectrum of therapies they are not able to do because they are performing transabdominal, transurethral treatments, but not endovascular treatments. And this is the part where we are acting. And interestingly, we are not only reducing the prostatic volume by using this endovascular treatment, but we are changing the anatomy, the structure, the texture of the prostate, and we are smoothening the prostatic muscles. We are decreasing the intravesical protrusion, changing the intraprostatic urethral angle, and all these parameters are beneficial to reduce this very complex symptomatology associated with the benign prostatic syndrome. By the way, patients get more and more educated, not only in Germany but all over the world. That means that they are looking in the web, they are reading more, and they are always very good informed that there are some minimal invasive male-friendly or man-friendly alternatives to a couple of older urologic therapies. And therefore, many of the patients want to have prostatic artery embolization. From my experience, prostatic artery embolization became one of the most patient-driven therapies in the last decades and couple of years, because patients are willing to be informed, at least, about the opportunity if they are suitable for prostatic artery embolization. And if yes, fortunately, you are not hampering any kind of later on urologic therapy, because you are only devascularizing and shrinking the prostate and offering the opportunity for any kind of urologic therapy for the future.
So for a gentleman that presents and has got irritative symptoms, or basically symptoms of PPS, or when your prostate is enlarged, and they go on to these first-line medical therapies.
Yes.
And some of these medical therapies actually affect testosterone levels in the body, which can have multiple side effects. And I don't think that's spoken about enough. One of the great things that Prof was talking to us about was how sensitive the prostate is to testosterone as you get older. And the fact is that by using the medication that we use, that we often prescribe to our patients when they have benign prostatic hyperplasia or syndrome, that these have the side effects can be quite debilitating in your life. And one of the things about prostate artery embolization, which I wanted you to elaborate about, was actually being able to stop these medications, because you are blocking the blood vessels and to the prostate themselves. So can you elaborate a little bit for us a bit about that?
Indeed, this is a very important point to discuss about. It's important to know and to realize that the sensitivity of the prostatic cells for testosterone is increasing with increasing age. And that means that the same amount of testosterone, or even lesser amount of testosterone circulating in the blood system, it's affecting more the prostate, but only the prostate, not the rest of the body. That way that any kind of medication like 5-RE blocking the testosterone efficacy would act more on the rest of the body than on the prostate. And insofar you have to take into account that you might have much more side effects in the body in terms of libido loss, and so on and so on. All of you know about the side effects of these medications, but you have only a limited effect on the prostate. Taking this aspect to account, it's a very clever approach and smart approach to block the vascularization of the prostate, and this way blocking also the testosterone efficacy solely only in the prostate, but not in the rest of the body. So far you are avoiding any kind of side effects characteristic for the 5-RE medication, and for sure one of the major effects of prostatic hyperembolization is not only reducing the blood flow in the prostate, but reducing also the testosterone efficacy and effect on the gland.
Yeah, because we all know that as you get older, your testosterone levels decrease.
Yes,
and those have, as you get older, that has effects on your body as a man, and your performance as a man. And then, the sensitivity of your prostate is increased as you get older to the testosterone. So therefore, when taking these medications, you're only further making it worse for the symptomatology of what it feels like when you have a lower testosterone level. So I think those are things that our patients need to understand a bit more about, So I love the way that in this procedure, it is a very systematic, well thought out, stepwise approach to everything that we do. It is not an experimental, let's have a look, let's think about it. This is a well-documented, highly researched topic that has proven benefits. If you go and look on Google and you have a look on the web, there are multiple multiple research topics and you can even look up Prof, which I'll add his details at the end. You can look him up and have a look at what publications he's actually done here in Germany. So I'm just really impressed that even urologists attend and come and learn from you, Prof, because at the end of the day, this is a benefit to our patients. Our patients, and I think we work together with urologists to make sure that everything that our patients do well. So that's just my opinions, but thank you so much for having a chat with me today, and we'll see how much we can grow PAE or prostate artery embolization in South Africa.
Thank you very much. It was a big pleasure to have you here. Hope to see you soon. And I'm very glad to support you everywhere to implement and to increase this excellent therapy, prostatic artery embolization, in South Africa and all over the world. Thank you very much.
Just thank you, Prof. All right.